The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Welcome to our El Paso Community PPE Coordination webinar. We have, looks like we have a full boat of attendees, so we'll go ahead and get started. I want to thank you all for joining us, and as with all of these calls, start with a couple of housekeeping items. I want to let everybody know that everyone is on mute. And so if you would like to ask a question to any of our panelists, please use your chat box to submit the questions, and we will have a Q&A session at the end of the presentations. So plenty of time for interaction there. Also want to let you know that a recording of this webinar will also be sent to everyone who registered. So again, thank you so much for joining us. I am very excited to introduce our topics today. We are going to give you a great overview of the PPE coordination that has been happening with this new enhanced partnership that the Medical Center of the Americas, the Paso del Norte Health Foundation, and UT Houston School of Public Health have with the City of El Paso and all of our coalition members. And so, as we've been saying, that a robust response to a pandemic has to be in partnership between the private and the public sectors. And so that's what we're going to talk today about. PPE, as you know, has been a huge topic for the last few months, and it's a complicated issue, much more complicated than any of us ever realized. So today we're going to talk to you about the community needs for PPE. What our partners at the Health Foundation have done to support this. We're going to talk about the public health issues around this, how to use the PPE, and different issues around that. We're fortunate to have had a big local uptick in production, so we're going to talk about the production of PPE in our community and how we work to fill some of the gaps. And then we'll finish up with just a quick overview of other efforts that this partnership has underway, and we'll have time for some Q&A. So to talk about this exciting work, we have a great panel today. We have Tracy Yellen, the CEO of the Paso del Norte Health Foundation, Dr. Kristi Mena, the Dean of the UT Houston School of Public Health in El Paso, Jackie Butler, the Director of Operations for El Paso and El Paso-Juarez, and Holly Trubowitsch, one of the board directors for Bio El Paso-Juarez. And my name is Emma Schwartz, and I'm the president of the MCA Foundation, and I'll be moderating today's event. So to get started, we are going to turn this over to Tracy to talk about what the Health Foundation has been doing. Oh, you're on mute.
Great.
Tracy, we're still not hearing you. Let me make sure you're, there we go.
Can you hear me?
Jackie, are you able to hear her? No, we're still having some audio. We're having some audio issues.
Okay. Thank you so much, Emma, and to everyone on the call today. It's just really a pleasure to be here. The Health Foundation, as many of you know, was founded in 1995.
Tracy, we're having issues again. Okay, yeah, let's go ahead and go to the next slide, and we will pop back into this slide as soon as, oh, you know what, actually, I will speak a bit about the overall project that we have had. Nope, you know what, we're gonna move on to public health and PPE. So Kristi, Dr. Mena, talk to us, thanks.
Thank you. How's my audio? Okay. So in this community-wide effort, I think we've all learned quite a bit about PPE, more than we've ever realized. It is a complex issue when you're talking about an epidemic and then now a pandemic, and the needs are very great worldwide, and no exception for our region. And so one of the public health aspects I wanted to clarify was, first and foremost, what is PPE? And we know it stands for personal protective equipment, but that means it's protecting the wearer of that equipment. And I think sometimes there's been a little bit of confusion about what the general public should be doing versus what the healthcare provider should be doing. And so on this first slide, just talk a little bit about protecting the wearer and all of the garb that a healthcare worker and a frontline responder should be wearing to protect themselves. And so most of our efforts have been on face masks in this united effort we have here that's led by Emma Schwartz and Tracy Yellen. And first and foremost, we've been focusing on the what some like to call the tongue twister, the filtering face piece respirators, or FFRs, with our primary focus on N95s. So the N95 masks are something that the general public should not be trying to get right now, because we need to save those for our frontliners and those working in healthcare. And there's been a lot of talk about, wait, what about P100s or PAPRs? So just briefly, I'll just distinguish between these. So when we talk about the face masks that are used as PPE, the letter stands for whether or not the makeup, if you will, of that filter is oil resistant. And that's really important in terms of that face mask ability to protect the wearer. So some of the filter media uses a static charge to retain the aerosolized particles. And if it gets oil on it, it won't be as effective. And so that N stands for not resistant. Okay, so the N95s are not resistant to oil-based or oil mist aerosolized particles. The number then tells you the minimum amount of airborne challenge particles that the mask can protect against as it's tested in the lab. So for the N95s, those masks keeps out at least 95% of the particles. Again, it's not oil resistant. The P100s can be used by lots of different other types of workers, such as industrial workers. The P stands for oil proof, and they can keep out greater than 99% of aerosolized particles. So those are the differences there. I just want to briefly mention the PAPRs, or the powered air purifying respirators. The PAPRs are very expensive, somewhat hard to come by. They do not have to be test fitted like the N95s. So the N95s are something that are fitted in a tightly sealed fashion to the face. It takes about 20 minutes to do that in the hospital setting. The PAPRs do not have to be fitted, but they are more expensive. They can be stored in parts, if you will. And so sometimes hospitals have trouble finding all of the different components. I think one area of the Texas Medical Center has only 7 PAPRs because they're about $1,800 to $2,000 a piece. They can be useful though if there's some reason a healthcare worker cannot have a tightly fitted face mask. So in this particular issue with COVID-19, PAPRs is another option. And then we also have the isolation gowns and gloves, etc. Okay, next slide, please. And so with that, what my next slide is going to show, it highlights and really emphasizes the way we all have to be careful how we wear the PPE, or it's not going to be effective. So I've already mentioned how the N95s needs to be fitted to the face, sealed, working with someone who, an occupational health person who has that expertise. There are numerous training modules in the form of videos available to talk about how to wear the other types of PPE. So the isolation gowns, gloves, face shields, goggles, etc. And just as important as it is to learn how to put on the PPE, it's also important to learn how to properly take it off. And so those videos are very detailed. Even before and after, you're looking for rips or tears in the equipment, making sure you have everything you need, making sure you properly dispose of the PPE. Most of these modules are sponsored or co-sponsored by NIOSH, or the National Institute for Occupational Safety and Health, and or CDC. Okay, next slide. So in talking about PPE, just again, I wanted to emphasize that surgical masks are actually not PPE. So surgical masks, even worn in the healthcare setting, actually provides the transmission barrier to the patient. So if a medical professional is working with a vulnerable patient, it will provide protection to that person. Just like when we have been advised to wear face coverings, some of us you'll see are wearing surgical masks, and some of us are making or purchasing the cloth masks. So that is not used as a protection for us. It's to protect us from possibly and unintentionally transmitting the virus to others. So this is a very important distinction. So by definition, those surgical masks and the cloth face coverings are not PPE, but it's so important during this pandemic because, as we know, if there's no exposure to a hazard, then there's no risk. But we know in the pandemic, there is a chance of exposure. So we need to do what we can to minimize the chance of transmission. Next slide. And so now as we talk about reopening Texas and reopening businesses, I know many businesses want to reopen. We all want those businesses to reopen, but we have to think about all the different ways there can be controls in that environment to minimize that transmission. And so there are both administrative controls and engineering controls, as well as the use of PPE. So we all see workers as well as customers, and hopefully wearing some type of face covering. And so that was a couple of points in my last slide that I wanted to highlight. We know that when we talk about best protection practices, and again, oftentimes it does use PPE, also, implements other types of measures, such as administrative controls. If you think about a grocery store, maybe they're going to think about who's working on what shift and what time and where those people are going to be in the store. Think about engineering controls. I think we've all seen now in the grocery store aisles, arrows pointing the aisle direction, flow of traffic. And then we have the role of the patron. So if a patron, a grocery store customer, enters that establishment but doesn't follow those same guidelines, it can really disrupt what the grocery store is trying to accomplish. And so the list goes on the different types of relationships and business operations that are taking place. But it's important that the workplace safeguards are there to protect public health and, again, minimize exposure. And so finally, what I want to mention is don't forget the fomites. And this is a really important aspect of transmission. So fomites, by definition, are inanimate surfaces that can contain a hazard, such as the novel coronavirus. And so whether it's your cell phone, or maybe it's a pen you're carrying, or maybe it's the keypad when you pay for your groceries at the grocery store, the shopping cart handles, those freezer door handles, those are all fomites. So we need to be aware that it's not just person-to-person transmission, but it's person, environmental source, and person transmission. And so this would, again, if we keep those safeguards in mind in terms of disinfecting those surfaces, as well as wearing PPE for healthcare workers and then face coverings for the general population, then we're doing our part to minimize transmission. Thank you.
Great, thank you, Dr. Mena. Dr. Mena and UT Houston School of Public Health have been doing a tremendous amount of work in this effort and other efforts in response to the pandemic. And I want to thank her and UT Houston's efforts for that, and also let you know that she has done some very specific training for certain industries, such as the construction industry, where they had a lot of questions on PPE. And so please feel free to reach out to us if you have a certain industry group where she can provide and her team can provide very specific education. And with that, I'm going to hand this back over to Tracy Yellen, who is the CEO of the Paso del Norte Health Foundation, a very key partner in our coalition, to tell us more about their efforts to increase access to PPE.
Great. So thank you very much. I assume you can hear me now. So I see a couple heads nodding. Great. My technical support, otherwise known as my children, were not available, so I apologize. But it's really good to be here. The Health Foundation has been working in partnership with this group, which has really been fantastic at bringing additional resources to our community. We've supported some messaging in partnership with the City of El Paso Health Department. You might have seen some of those on TV or heard them on the radio. And we have a number of response funds to help respond to the needs of our community. So a few of them are direct support to nonprofit organizations supporting those nonprofits that are supporting the most vulnerable in our community, homeless, homebound seniors, food insecure. We have a fund with EPISD that is helping to raise money for El Pasoans Fighting Hunger, who are feeding thousands of families in our community. A young man, Nicholas Spurback, has set up the Fortify the Heroes Fund to help feed healthcare workers working on the front lines, our healthcare heroes. and the El Paso Food and Beverage Fund in partnership with local restaurateurs and the Workforce Solutions Borderplex to provide gift cards to laid off food and beverage workers. But the final two funds at the moment are really focused on this huge need for protective equipment. And so we have the Juarez Response Fund, which is raising funds to help purchase PPE for Juarez, working in partnership with this group who's been so helpful at sourcing and identifying PPE and vetting those sources. We've been able to facilitate about $120,000 of purchases of PPE for Juarez. In addition, we're working, the Health Foundation's made a grant to the Medical Society to help them purchase additional PPE, and then we're working with local makers, these really extraordinary, this little army of technology experts who put their 3D printers to work. Some of them at the Fab Lab El Paso, which is a really terrific nonprofit organization, and others just that have these available to them, and they have begun producing in significant quantities both face masks and face shields that they're selling for a donation of $1 or $2 each, making them 500 to 1,000 of those a day. And so you can learn about any of those funds and give to any of those funds, but also learn out how to order that local PPE, the face shields and face masks at pdnfoundation.org. So really, really easy to order and pick up. And we know that the city of El Paso has some PPE for healthcare workers, hospitals, and others, but we also know that many other kinds of providers are looking for more than a face covering, a homemade face covering, or maybe more than an N95 that they may or may not be able to get, that this additional face shield and face mask are really helpful in their workforce settings. And then finally, I'll add, working with Dr. Mena and Emma and Jackie and Holly and others, we're trying to put as much of this information to make it as easily accessible to the community as possible. And so we've developed the epcovid19.org website, which includes lots of community resources. Where do you find childcare to get back to work? Where do you find food through the food bank or other sources, but also for businesses. Now that more of us are going back to the workplace, as my staff likes to remind me, we're not going back to work. They've been working for these few months, but we may be going back to the office. And how do we do that safely so we don't harm ourselves, harm our colleagues, or bring something back home if we live with someone who is vulnerable? So that is so important. And we've begun to populate the website and the Business Resource Center, first with sources of PPE that Holly's going to talk about, but also some of these tips and guidance that Dr. Mena has addressed, so that you can, follow, like how you remind yourself. Some of it seems so basic and simple, but if I put my cell phone on the counter and someone had done something similar before and had COVID, I could pick that up. Or how many people in my office can be in the kitchen, or, like just simple tips and tools like that to keep us all safe. Our goal, we all want to go back to work, but being safe is so key for all of us, for our entire community to be able to do that. Finally, the source includes some new information about currently available testing, and we're hoping with this partnership to really be able to expand those opportunities, especially for employers, as your employees, and want to know that they're safe, and that just is another tool to help keep us safe. So thank you so much again for the invitation. We're happy to answer questions later, but again, all of that is either at pdnfoundation.org or epcovid19.org.
That's awesome, Tracy. Thank you so much. What an impact you all are having on our region. I'd now like to introduce Jackie Butler. She's the director for Bio El Paso Juarez. It's our binational organization that represents the region's medical device manufacturing industry and cluster. So she's going to talk about the industry's response to COVID-19 and the PPE needs in this region.
Thank you, Emma. Thank you, Tracy, Dr. Mena, and Holly for participating on this webinar. So I am very fortunate to work with Bio El Paso Juarez and the MCA here in El Paso, and we've been working over the last several years to bring together the medical device manufacturing sector not knowing that it would play such a huge role in the last couple of months in our community's ability to respond to this pandemic and to the PPE needs that we're experiencing. For those of you who aren't aware, we have over 35 medical device manufacturers here in the region producing a wide variety of medical devices in huge numbers. They represent about 40,000 people strong in the workforce, both here in El Paso. And when COVID-19 really hit our community in mid-March, we quickly pulled together a survey to try to understand not only the capacity for our regional medical device manufacturing sector to respond to the PPE needs, but also to try to understand how their operations were being adversely impacted by the pandemic. And what we found, and I put the link to the survey, the report of the survey here on the screen for you all if you're interested in looking it up. But what we found was that, first of all, the manufacturing sector here was just starting to be impacted by the pandemic. It's been almost 2 months since that survey was sent out, so I can say with certainty that has changed significantly since then. But a lot of the manufacturers here in the region are worldwide corporations, and so they were already experiencing some of the adverse supply chain disruptions coming out of other parts of the world in response to the pandemic. And so we were starting to see trends and trickles of impacts here locally. But we did know that we did not at that time have a significant number of manufacturers who were producing personal protective equipment. And so we wanted to gauge the capacity for manufacturers to either transition to PPE or to be able to facilitate that kind of production through partnerships or other types of arrangements. And so over the last 2 months, we've seen a significant increase in PPE production. We are very, very fortunate to have been able to bring together a lot of the regional manufacturers into a response task force that meets twice a week, that allows us as community partners to understand how the manufacturing sector is responding, some of their biggest needs and challenges, and then connect them to resources that might be able to help. That task force meets twice weekly without fail, and it's been a really great forum for people to discuss the potential for the manufacturing sector to help us with our PPE needs. We also developed a forum that allows manufacturers and suppliers primarily to be able to interact with one another and talk about their abilities to contribute to PPE needs. But we still face significant challenges as an industry. Supply chain disruptions continue to be experienced. Although the supply chain has loosened a bit out of certain parts of the world that were primarily impacting the medical device sector in China and Asia, with the global demand for PPE, we haven't seen a large ability for those supply chains to be enhanced or replicated here yet. Workplace safety is an issue, as it is with every sector and every industry that continues to work. The medical device manufacturers in Juarez and here in El Paso have been considered essential since some of the policies were put in place. However, in the Mexican federal and state policy levels, there have been some recent issues that have challenged the ability for some of the manufacturers to continue operating. And so within BioEPJ and this task force that we've developed, we've made a concerted effort to try to educate the manufacturers and bring in resources from the federal and state levels in Mexico to guide the manufacturers relating to some of those challenges. And then reopening. So we're experiencing within the manufacturing sector the same challenges that everybody is. How do we continue to maintain operations while keeping employees safe and healthy, and how do we prepare for this new normal of operations? I mentioned supply chain disruptions, and we've seen just looking forward that there are significant opportunities for our region to continue to play a role in PPE manufacturing and production. And so within BioEPJ, we're very focused on where those supply chain bottlenecks are happening and where those opportunities might be to bring some of those supply chain resources closer to our region so that we're not trying to extend all over the globe to get those much needed supplies. Melt blown is a really great example for N95 mask production. It's something that everybody has been trying to get their hands on, and it's one of the primary reasons that N95 masks are in such short production is because that melt blown material has primarily been sourced out of China for the last couple of decades. And so those are the kinds of things that we're trying to target very specifically, as well as training the workforce. How do we help manufacturers that might, for example, be able to make non-medical face masks or are in the garment production, be able to transition their production lines to allow them to be able to make medical grade PPE that would be able to source our healthcare workers and frontline workers. I put in a little graphic here that shows what our medical device manufacturing ecosystem looks like, but we really believe that as long as we can maintain optimum operations for our medical device ecosystem here, support them in their needs, whether it's policy issues or production needs or technical needs, we'll be able to really enhance this ecosystem in the long term. I'm happy to take questions if anybody has any after the next presentation.
Great, thank you so much, Jackie. A tremendous amount of work there. I'd now like to introduce Holly Trubowitsch. She is on the board of directors for Bio El Paso-Juarez and truly an extraordinary volunteer who stepped in and stepped up to help us in our PPE efforts as we realized that there was a monumental and sometimes tedious task of trying to understand the PPE needs in our community and pairing it with vendors. And so Holly, please tell us about the work you've been doing.
Yes, thanks, Emma. So we started out trying to figure out what our PPE needs were here in the community, and we coordinated with the entities who were already working in this space. First of all, the border rack, they've been enormous. We determined which items they could supply and who they could supply them to. They are handling things like gloves and masks, but not disinfectants or non-contact thermometers. We also worked with the El Paso County Medical Society. They were really integral through this whole process, and Patsy Slaughter and I are now on speed dial. She's been a wonderful help. Spoke with Chief Rodriguez in the Office of Emergency Management to make sure we weren't duplicating any efforts. We compiled email data from about 80 different industries, including home health agencies and adult foster care, all the way to construction and hotels and car and motorcycle dealerships. We put together an order form that was sort of in a survey format. We figured out about 15 different items that could be included for people to order from the medical field, and then culled that for non-medical companies and made 2 different order forms. We sent emails to almost 1,600 companies with a link to the order forms. And from that, we got about 70 orders, which represented over 43,000 items that were needed in the area. So then we thought, okay, how do we fill these orders? And actually concurrently, we were working on a list of reliable vendors. We reached out to local vendors. First on the list was our Bio El Paso-Juarez members in the medical device manufacturing sector. There were other vendors that contacted the MCA, and we received some other names from local customers. We validated the vendors by requiring them to supply their vetting methods in writing of the vendors that they used. We worked with them to do a group purchase strategy. We aggregated the purchases of all of the people who responded to our email and wanted pricing based upon that aggregate order, but we wanted all of our responders to be able to place their own orders with their own money and to receive their shipments themselves. And thankfully, every vendor who we spoke with complied with that. We received their quotes, their prices, which are always fluctuating, minimum order quantities, availability, and put together a master spreadsheet with all the information. Then we responded to all of the orders and sent everyone the spreadsheets. There were 2 different spreadsheets, one for medical, one for non-medical. And we created border rack order forms for the appropriate orders. We also posted this PPE list on Tracy's website, the Paso del Norte Health Foundation's epcovid19.org website, to sort of broaden the availability of this information. There was one item that we've been unable to fulfill, which is the N95 mask. We do have availability of genuine 3M N95 masks in Los Angeles, but they have a minimum order quantity of 25,000. There are N95 equivalent masks available, but their delivery time is a couple of weeks and their minimum order quantity is 50,000. So currently we have about 15,000 mask orders to date. We've reached out to Medical and Dental Society, Hospital, Surgical, here in El Paso, across the border in Juarez, but we're at 15,000. There is another vendor who we're considering, but we're still vetting them. They have a small minimum order quantity. But so anyone who needs N95 masks, please contact me, send an email to elpasoppe@gmail.com. We could really use help reaching our minimum order quantities. And that's it. Thanks. Back to you, Emma.
Thank you, Holly, so much. A tremendous amount of work, as you can see, and just being able to try to connect with employers is difficult. So I do have to send a shout out to the Paso Inc. because we did use their book of lists, which has a lot of valuable information compiled by industry, and then a lot of just hard work from some interns at the MCA and MCA staff to try to track down email addresses. But of course, we're trying to broaden the way that we reach out because not everybody's good on email. But wow, panelists, thank you so much for sharing that information and the work that you're doing. As you can see, this is a lot of tremendous work. And so in order to pull all this together and coordinate it, our enhanced partnership pulled together a PPE committee, kind of a task force that meets every week, every Thursday. So if anyone on the call wants to be included in that task force, feel free to reach out to me and we'll include you in that. But we go through weekly all of these different issues to make sure that we are as coordinated as possible, that we're communicating very well with each other so that we're not stepping on each other's toes. As you know, there's a lot of work going on right now, and everybody wants to be helpful, but sometimes helping can get in the way, and we're trying very hard not to do that. We have some tremendous work being done at the city and county public health departments, at the OEM and Border Rack and other critical partners, and so we appreciate their support and partnership. I do want to make one note also about something that you might have heard about, because just today the city of El Paso put out a press release about the Battelle decontamination unit that has arrived here in El Paso and is now set up, functioning, and open for business. So more information will be coming out regarding that unit soon and its decontamination capabilities. But to what we know, it can decontaminate up to 80,000 N95 masks per day, which is exciting. There are most certainly limitations on what kind of PPE it can decontaminate. So it really is focused right now on N95. There are some other equivalents that it can decontaminate that are waiting for FDA approval, but there are some things specifically it cannot decontaminate. And so we need to make sure that we follow all the procedures for that. But that's tremendous. And what else is really exciting is that we reached out to our friends in Juarez, where they are really struggling for PPE, much more so than El Paso is. And we are working with the U.S. Consulate and many others, including Battelle, to come up with a system, all of the permissions and the logistics for decontaminating N95 masks and equivalents coming out of Juarez and returning them so that they can reuse these masks that are in such short supply over there up to 20 times. So that's a tremendous tremendous thing for our community. And so if we can, right, so I wanted to put all of this in context as well. So our committee is not just looking at PPE. We've realized that each question that you tried to answer is very complicated and interwoven with the other issues and efforts around a pandemic response. So I wanted to just briefly touch on some of the other efforts and other committees and work that's underway with regard to this public-private partnership. To begin with, as many of you heard, and there've been a lot of press about this, the Medical Center of the Americas was able to retain the expert services of Battelle, the largest nonprofit research lab in the world, to support our community's response to the pandemic. We were able to do this through some generous funders, including the Paso del Norte Health Foundation, the Hunt Family Foundation, the Foster Family Foundation, El Paso Electric Company, the Public Service Board, the One Gas Foundation, Westar Bank, and also TransTelco. So a lot of people coming together to support this. And Battelle has sent one of their leads in this area of healthcare quality and pandemic response, Dr. Nicole Brennan. She actually sat at the OEM for about 15 days, providing support and expertise there, which has been fantastic. We also have a committee on private sector testing and contact tracing. As you all know, as we speak about reopening, it's very important for us to get employers the types of testing that they need to be able to reopen safely and have their employees feel safe as well as their customers. So we're looking at different ways to enhance what the city is doing there. The city has already tremendously enhanced the testing capability throughout the city, but for a short time anyway, we know that there will be huge demand for testing. It needs to be very well coordinated with our city public health department, their contact tracing abilities, so that we can respond effectively. I also want to give a little shout out to the Better Business Bureau and Mary Beth Stevens, because upon hearing about the work that we were doing, they had a very good idea for providing education to the employers that they represent, as well as other employers. So providing posters and resources that they can access to really state to their customers what they're doing to protect them and their employees. So hopefully that we get a good response and collaboration with these employers. And the last thing that I want to bring up is also Juarez support. There is a tremendous amount of need in Juarez related to PPE, as we've been discussing, contact tracing, all the stuff that Jackie was talking about from a political standpoint and policy. And so we have had some very good support from Battelle and all of our partners that you heard from today to support our neighbors in Juarez. So there's a lot of work going on for this effort. And so I'm excited that you were able to join us and listen to this. I want to switch now over to our Q&A mode. So if anybody has any questions about any of this to any of our panelists, please send it in the chat box and we will look at that. One of the things I want to ask the audience is, you know, and again, they can respond in the chat box, is if they feel that there are any ways that they need to be, or feel that they need to be supported through any of these efforts. So not just questions for us, but also requests for help and support from the community that's listening.
Emma, this is Ivana Sanchez. I have a question. It says, hello, I missed the first few minutes. Will this PowerPoint slides be provided to the attendees? Yes.
Yes, they will be. After this, we will have a recording and the PowerPoint that was presented that will be sent to everybody who logged on and is attending the meeting. And let me actually ask this to Jackie and Ivana related question. We've had a few other webinars and meetings such as this. Are they generally, are links to these meetings posted somewhere?
Yes, ma'am. So I usually post them on the MCA's social media. They go out the day after these webinars have been hosted. And I think we were also talking about collaborating with Tracy to be able to upload these videos onto the hub of information that they have. So that should be in the works soon. There's another question. There's a couple questions coming in, and I'll just read them off as they come in.
Great. I'm not seeing them, so thank you.
Can we please get the address for the PPE again? And that was for the form for the PPE, or?
So I think we have a couple of things. Tracy, if you could tell us the website address for the information hub, and also Holly, if you could tell us the email address where I see it on the screen now, but if you could both talk about that.
Okay, sure. So the resource hub is epcovid19.org. If you click on the Business Resource Center, the first question is, where can I find PPE? And you'll see the vendor list that Holly put together and some of those resources available. Secondly, to order the face masks or face shields from the local makers, you can go to pdnfoundation.org, click on Resources, click on Equipment and Supply Fund, and you'll see the order form, the link to the order form for those items there.
And my email address is elpasoppe@gmail.com.
Okay.
So if you send Holly that an email there, she can send you the appropriate survey.
We got a question from Cecilia Varela saying, what are the expectations of PPE for the next month, for the next coming months?
Goodness, that's probably a good question for Holly, but I think that, you know, Kristi Mena and I did an employer focus group recently. She's been doing that a lot. And I think that it's hard to get your arms around a solid number around that, especially as employers who have never had to use PPE in the past are starting to come to the realization that they will need to be opening in the next few weeks. And these are folks like car dealers who have never had to use PPE in the past. And so I think that any number we would give is highly imperfect because people don't even know what they need right now. And over the next couple of months, that need is going to skyrocket, in my opinion. But again, they are different kinds of PPEs for different settings.
And from a vendor standpoint, sorry, Emma.
Go ahead, please.
From a vendor standpoint, I'm seeing a lot of availability coming up mid-June and the beginning of July for items that just have been very difficult to obtain. So it seems like there was a 60-day lead time that started a few weeks ago. And so things should start to ease up in the next 45 days, I'd say.
Okay. Emma, I just wanted to add that we have, I mentioned that we have seen some manufacturers be able to transition to PPE. So we now have local manufacturers who are producing face shields, gowns, and non-surgical masks, so face coverings, in the tens of thousands of units per week. And so at least in those cases, with those specific PPE needs, we have very, very secure sources for the foreseeable future.
Yes, and all of those vendors are included in the PPE source list.
I also want to mention that the vendors that Holly is working with have been put through some sort of vetting, because there is a lot of fraudulent material out there. There are fraudulent test kits, fraudulent face masks, just fraudulent stuff going around, and also vendors who are price gouging or promising product, taking down payments and disappearing. And so part of this process is try to make sure we're only working with vendors who have been through some sort of vetting.
Okay, and we have a question from Annette Gutierrez saying, will the United Way offer a lunch and learn for nonprofits on how to reopen? I'm not sure if she was referring maybe to the Better Business Bureau or maybe just to United Way.
I can take that. I'll reach out to the United Way. I think that's a great idea. The Health Foundation has a grant to the United Way for monthly lunch and learn series for board and staff members, and so that's a great idea. I will follow up on and then we can also email, kind of be proactive with some of the resources on the information hub to help people return to work safely.
I also want to emphasize the fact that as our community reopens, but those of us who are staying engaged with the news and checking the numbers, if your organization doesn't have to reopen and can continue to work from home as long as possible for your organization and still be functional, even beyond what you're required to, it is advisable to do so. And so again, the more that we social distance, the more slowly the spread will happen. And so if you are not serving customers, if you have more professional jobs and can continue to work from home, I think that is a wise thing to do beyond the dates being given by our city or state. Ivana, do we?
Oh, we just have one last, it's more of a request. Melissa Harcrow from representing the mayor's office would like to be invited to the weekly meetings, I think, of the PPE talk with BioEPJ.
Great. Could you get her email address and also just if you could indicate exactly which meetings. We have bi-weekly task force meetings of the BioEPJ group, and then we have the weekly PPE coordination meetings, and we also have weekly private sector testing meetings.
All right.
So again, if anyone wants to join those, they can just send over their email address and which committee they want to be included in.
That is it for your questions.
So if I could reach out just in kind of closing remarks from our panelists, if you could please let us know and share with the audience ways that our audience could potentially support you. So Tracy, for example, the different areas again that you're looking for financial support or other support, and likewise with our other members.
Sure, so I'll start. A couple of things. One, pdnfoundation.org, you can find a list of the varying COVID response funds that I'd mentioned earlier in our program, and share, give, whatever you can is really helpful. Secondly, I think on the ebcovid19.org site, if you can share those with your colleagues and employees and friends and family, that would be great. We also have a button in the upper right-hand corner where you can help suggest additional content. So if there's something that you know that's available that would be helpful, we update that site daily with information. A lot of this information is there to complement what the city's put together at epstrong.org, from sources other than governmental sources, so that we have, a really diverse range of information available to the public.
And Jackie, do you have any ways that our audience that you're requesting support?
Absolutely. I think definitely if you can get engaged or participate in any of the meetings or discussions that happen, the more people that we can get support from and get more feedback from to ensure that we're doing everything that the community needs in response to the pandemic would be very helpful. We have our social media links up. Following us on social media is a really good way to stay engaged and help us spread the word about the important role that our manufacturing industry is playing in responding to this pandemic. And lastly, I think just supporting those essential workers that are still out there and really making a difference and allowing us to be able to safely continue to work and work on these different initiatives that are very important to our communities. In Juarez especially, we have a lot of maquiladora workers who are very much needed to continue to make medical equipment, devices, ventilators, PPE, and they need as much support as possible during this time, as well as our healthcare and public safety workers.
Holly, how about you?
The one thing I mentioned already was anyone who needs the N95 masks, please reach out to me. The other is anyone who has other sources for PPE and other items that are needed now, disinfectants, hand sanitizers, anything that's available here locally that I do not currently have on my list, I would love to add them. So please feel free to send me alternate sources as well.
And along that line too, I have gone out very little in the last couple of months, but I did go yesterday to a dental appointment because they have very sparsely reopened and I needed to get in and I wanted to do some secret shopping. And so I asked the employees there and the dentist if they needed access to PPE, and they said they desperately did. And I asked if they knew about our initiative and they did not. And so after that, I came back and started to try to connect the dots with them, and we were able to focus some attention there. So if you are out and about or you know of people, please let them know about the efforts we have underway. Ask if they've received the emails or the questionnaires. If they haven't, please refer them to us, because again, it's hard to get in front of everybody and different people communicate in different ways. Dr. Mena.
Yes, thank you. Yeah. I would really appreciate hearing from any of you regarding your thoughts on specific business operations, on how you might better and maybe more effectively reopen, or as a customer of those businesses, or even within your household, if you suspect someone might be infected. What are your practices at home? And as Emma and I talked about, and through efforts with Tracy and Emma and the MCA and the Paso Norte Health Foundation, we're really trying to come up with specific safeguards to reopen safely. And there are a lot of very useful information out there, and there's different ways we've seen different organizations package that information. But I think it would be really beneficial to hear from you so that those safeguards are informed, because maybe they sound good in theory, but in practice they won't work well. And we've all been in the crowded grocery store with the long line down the aisle that now forces you to go the opposite direction, or just even an establishment's the capacity restriction, and them trying to make that requirement, but then we're creating more customer encounters because everybody's entering and exiting the same door. So things like that, I would really appreciate hearing that type of information. As the School of Public Health, we're also have been tasked with providing more specific guidelines, and we're going to start a webinar series next week where they'll be about 90 minutes long with only 10 to 15 minutes of a presentation. They'll be industry specific. If you're interested in participating, we would love that, because there's going to be a lot of time for question and answers, and this is going to be a place to get feedback from all of you, and perhaps we can come up with solutions together. So I can tell you next week, I believe it will be on Wednesday, we'll start with the retail industry. The following week will be restaurants and so forth. So I'm eager to hear from you and your interest and how you can inform this process.
And I'm hoping that those dates, times, and links will be on the Health Foundation's website that Tracy was talking about. So again, we can have everybody seeking the same resources for communications. And so again, I want to thank you in closing this out. I want to thank you for all of the hard work that the City Public Health Department, the County of El Paso, the OEM, our first responders, and our hospitals are doing to respond to the pandemic. I also want to thank our partners in the public-private partnership and the coalition for their support. Again, we can only do this effectively through a great collaboration, and I'm so proud to see how our community is coming together to work together to make sure that our city and our sister city Juarez come through this as strong as possible. So thank you for being on the call today, because information and education is a big part of this. If you have any questions, feel free to reach out to us, and I hope that you all stay healthy and happy. Have a good evening.
Bye. Thank you.
Thanks, Emma.
Thank you
Thank
all.
you. Thank